Hi everyone, my name is Meg Gartland, and for my Comparative Health Problems project, I'm going to be talking about the public health issue of infant mortality in the United States, Japan, and India. Infant mortality is defined by the death of an infant before the age of 1, and it's determined by the number of infant deaths per 1,000 live births. Infant mortality rate, often referred to as IMR, is a really important indicator for overall health of a society, and it's often used as a measure of population health because infants are a vulnerable number of the population. So by examining a specific population's infant mortality rate, it gives us insight into a society's social, behavioral, economic, and health risk factors that contribute to the overall health. And as a society, you would want lower infant mortality rates, as higher rates can be seen as worse health care. So there are many causes of infant mortality, and a lot of the reasons of why these things happen are unknown, but according to the CDC, the 5 major causes of infant mortality include birth defects, preterm birth and low birth weight, pregnancy complications, sudden infant death syndrome, also known as SIDS, and other injuries. And something interesting that I noted under the cause preterm birth or low birth weight was that although mortality due to preterm birth complications are typically high in developing countries, preterm birth also remains a major cause of infant mortality even in developed countries like the United States. And like there are many causes to infant mortality, there are also many proposed solutions. So public health programs have played a central role in the decline of infant mortality, especially here in the United States. In the early 1900s, these types of public health programs emphasized large structural interventions like filtering and chlorinating water supplies, building sanitation systems, developing the birth and death registration area, pasteurizing milk, and also educating mothers on infant care and hygiene. And we learned in lecture that changes in healthcare are often path dependent, so it's important to learn the history behind certain issues. And I think that's really important here with infant mortality, as here in the United States we've already decreased that number drastically. Between 1915 and 1950, the infant mortality rate in the U.S. declined from 100 to fewer than 30 deaths per 1,000 live births. And this was before the use of technologies and vaccines, so it's understandably higher than it is right now. Another public health program that was used as a proposed solution is newborn screening, and this would test for between 29 and 50 hidden conditions that could lead to death if not treated. Another very important solution to infant mortality is adequate prenatal care. This reduced the risks of birth defects, which were a major cause of infant mortality, and they are crucial to ensure full-term infants are born at a healthy weight. An example of prenatal care would be taking folic acid before and during pregnancy to prevent neural tube defects that could lead to birth defects. And then lastly, pre-pregnancy care for mothers is important, as improved women's health helps to reduce risks. And then to improve their health, it's important that they receive proper nutrition, are at a healthy weight, and manage pre-existing health conditions. This chart shows the trends in infant mortality rates between 1970 and 2017, and to do this it uses the average infant mortality rate between the OECD countries, and as you can see it's been declining since 1970, actually a lot. This graph shows a 50% decrease in IMR in 17 years, and this would be due to implementing some of the solutions that I was just talking about. So like I said at the beginning of this presentation, I'm going to look at infant mortality in 3 different countries, and here are some of the United Nations classifications of the countries that we're going to be talking about. So the United States and Japan are both developed economies with high income. And then India, the third country we'll be looking at, is a developing economy, and it's classified as a lower middle income country. And this slide here shows the current infant mortality rates for each of the countries according to OECD. So you can see that Japan is by far the lowest with 1.9 deaths per 1,000 live births. USA is fairly high, especially compared to other OECD countries, which we'll see in another chart later, but we're at 5.8 deaths per 1,000 live births, and then India is extremely high at 29.9 deaths per 1,000 live births. So this is the graph that I was talking about that compares the infant mortality rates on a chart of the 3 countries we'll be talking about, as well as many others. And it even divides it further into neonatal mortality, which is defined as deaths of children under 28 days old per 1,000 live births, and then post-neonatal mortality, which is deaths of children between 28 days and 1 year of age per 1,000 live births. But you can see a lot more clear in this graph that India is at the way high end of the spectrum with infant mortality rates. United States is somewhere in the upper middle, and then Japan is at the very lowest end. So for the rest of this presentation, I'll be talking about the health systems in each of the 3 countries and how they're all dealing with infant mortality. And while I do that, I'll be incorporating some similarities and differences between the countries. I'll start by going over the healthcare system that we have here in the United States. So we have no universal coverage. We have a very strong private sector with limited government role. We also have a combination of employer-sponsored insurance, Medicare and Medicaid, and uninsured citizens. And Medicare and Medicaid are examples of public insurance, so they are government-sponsored and were enacted 75 years ago in the U.S. Medicare provides insurance for those aged 65 and up, and Medicaid provides insurance for low-income families and individuals. And also, we have a market-maximized healthcare system, which means that it's run by the market. It's a demand-side approach, so basically, if you can afford insurance, you can buy it, or you can apply for government assistance. Versus, you'll see later on, Japan is more market-minimized because it is nearly all run by the government. And this is a part of the reason that we have a little bit of problems with unequal access to healthcare in the United States. And then moving on, we have little emphasis on preventative medicine. We have a lot of specialists here in the U.S., but a shortage of primary care physicians, which includes OBGYNs, which would be crucial in infant mortality, as well as family practitioners, pediatricians, etc. And then lastly, we have very high healthcare spending, yet only average healthcare outcomes. And these average healthcare outcomes are seen in our relatively high infant mortality rate when compared to other OECD countries, especially Japan. And then with our healthcare system in the back of your mind, here is how the United States is dealing with infant mortality. So there are multiple improvements to be made and that are attempting to be made. So one is to reduce the risk of birth defects. This is the leading cause of infant mortality in the USA. So there are a lot of public health programs that focus on this. And they do this through emphasizing prenatal care, which can reduce the risks of many of the causes of infant mortality and decrease pregnancy complications. And then another improvement that we're striving for here in the U.S. is to decrease health disparities. And while we are still decreasing our infant mortality rate, there are a lot of challenges that come along with that. So in most cases, the cause of preterm birth, which is the second most common cause of infant mortality in the U.S., the causes of this are unknown. So there's not always an effective treatment or prevention option to stop preterm birth. And then I found this quote in one of the articles that I read. More than 37 million Americans do not have health insurance, and 41 million more have inadequate access to health care. Without access to health care or insurance, future mothers cannot regularly see their doctors for prenatal care and checkups, which does not help the issue of infant mortality. Another challenge that we kind of touched upon when I went over the health system here is that we have a primary care physician shortage. And primary care physicians include OBGYNs that would be very instrumental in helping educate women about prenatal vitamins and seeing them regularly for checkups to see if the baby's doing okay and stuff like that. And then another challenge that we face are those disparities in health outcomes that I mentioned. So In the US, low-income individuals and minority groups are disadvantaged, but achieving health equity is a challenge in both the US and India, you'll hear later on. Now we'll move on to Japan's healthcare system. So unlike the US, Japan does have universal coverage. They established the National Health Insurance System in 1961, and the National Health Insurance System has helped to achieve Japan's low infant mortality rate because it ensures that all mothers and infants will have access to the care that they need to prevent infant mortality. Another difference in Japan is that the insurance is not for profit, so the insurers cannot make money, but they definitely can here in the United States. Another thing about Japan's health system is that they have what's known as free access, so patients are free to choose physicians and healthcare facilities that they want. They don't have to go to one specified by the government or anything like that. They also have what's called the Bible of healthcare costs, which is a way that they can control costs. So Japan only spends about 8% of their GDP on healthcare, which is really low, and physician fees and other medical fees are closely regulated by the government. And lastly, Japan is a market minimized healthcare system, opposite of the United States, and they have a lot more government intervention, which is not a popular idea among US citizens. So after talking about their health system in Japan, here is what they are doing to combat the public health issue of infant mortality. In Japan, they have a very unique clinical management of preterm infants. Their preterm birth rate is only 5.7% compared to 9.6% in the US. Also, they have a perinatal healthcare system, so they provide high-level intensive neonatal care and high-level intensive obstetric maternal fetal care in one medical center. So in order to be a perinatal medical center, they have to have both a NICU and obstetric unit, which lowers the amount of newborn transfers. And this is an important change that they've made because outborn infants who are transferred to high-level NICUs, for example, in the US after birth, have a poorer outcome than inborn infants who are born in third-level NICUs. So lower transfer rates may explain the relatively good outcomes of preterm infants in Japan. So also these perinatal healthcare systems provide circulatory management, invasive respiratory management, nutritional and infection management for newborns, and these have been thought to contribute to their low infant mortality rates. For example, nutritional management, it has been seen that the incidence of a disease that infects the intestines of infants is a lot lower in Japan than in other countries, and this low rate can be attributed to the nutrition management of extremely preterm infants in Japan. Additionally, because of the good infection management that they have with infants in Japan, the incidence of late onset sepsis was found to be a lot lower here than in other countries. So, for example, they take standard precautions set by the CDC in the USA, and they take those a step further and are very careful and cautious when dealing with infants in the NICU. And then lastly, the Neonatal Research Network of Japan was founded in 1998 specifically to promote research and improve NICU care and outcomes of sick newborns. And then like any country, Japan faces challenges with decreasing infant mortality. Some of their challenges include efficiency and coordination of primary care. There's no gatekeeping in Japan, and this is questioned by some researchers as potentially decreasing the efficiency of their system, as the coordination could be made more difficult when dealing with infants. And then also, like in the United States, the cause of preterm birth is oftentimes difficult to determine, so it's hard to propose solutions to something that you don't know the reason why it's occurring. Okay, and then the last country we have to talk about is India, so I'm going to go over their health system briefly. So they have a 3-tiered public system. The first tier is public health care centers and villages. Then they have district hospitals, then tertiary care hospitals. They have unequal access to health care due to socioeconomic barriers. For example, the poorest receive small amount of subsidies compared to the rich. The poorest 20% only receive 10% of the available subsidies, and the richest 20% receive 33 of them. And this division between socioeconomic groups and inherent problems of inequality make India similar to the US. And then lastly, they have low government spending but high private health spending. And as I mentioned at the beginning of this presentation, India has one of the highest rates of infant mortality in the world. So a quick stat for you is 1/3 of the 5 million infants in the world who die before the age of 1 are from India. So they've been trying to obviously decrease their infant mortality rates, not without some challenges though. So a few improvements they've been trying to make are include education to increase female literacy. They found a strong negative correlation between female literacy and the infant mortality rate. And then also they want to increase primary health care services provided. And then the challenges with that are that approximately 65% of the Indian population live in rural areas, and the village clinics in these rural areas are understaffed and have limited supplies. And then also maternity and postnatal care are not high priorities in the healthcare budget. And some conclusions that I thought were important to make after looking at infant mortality across these 3 countries was that Japan was the only country examined that has universal healthcare and also happened to be the country with the lowest infant mortality rate. The United States and India both face issues with inequality in healthcare, which creates a divide between their socioeconomic groups and ultimately leads to disadvantages for low-income individuals. And then all 3 of the countries experience similar causes of infant mortality and challenges in preventing infant mortality, even though Japan and the US are developed countries and India is only a developing country. And then lastly, infant mortality rates have decreased everywhere over time, and there are constant efforts to lower the IMR further. And that's the end of my presentation. Thank you so much for listening. I hope you learned something about infant mortality and how these countries deal with it differently.